Hey guys, March is Endometriosis Awareness Month, and along with all of the videos that we're going to be bringing you this month to explain about endometriosis and how you can manage it holistically, we've also just launched Endo Runner. So Kylie Brown, one of our ambassadors, she's just had endometriosis surgery on the weekend, and she's pretty keen to show you all that you can absolutely live with endometriosis and do all of the things you want to do. So her big goal is to run the Melbourne Marathon later this year in October. So we're going to be helping her go from endo surgery to marathon. You can follow her journey on Instagram at endo.runner. Check it out. She shares her story on there as well, and hope you guys enjoy this series of videos. Hey guys, my name's Ashley Mason. I'm one of the physiotherapists here at Upwell Health Collective. One of my main areas of interest is women's health, and March is Endometriosis Awareness Month. So over the month of March, we decided that we're going to each week release a different video that touches on different aspects of endo management, so that if you do have endometriosis yourself, you can hopefully better manage your endo holistically. The different areas that we're going to cover are what is endo, including signs and symptoms. We're going to touch on medical and surgical management, which is obviously a really big bracket. We're going to look at movement and mindfulness as well, and how understanding your pain can help you manage your pain with endo. So what is endometriosis? Endometriosis is a chronic progressive condition in which the cells that usually line the inside of the uterus, the endometrium, start to grow elsewhere in the body. So this can include other areas of the pelvic cavity, like your ovaries, fallopian tubes. Sometimes they can attach themselves to pieces of bowel, and they can cause lots of trouble because it is like an inflammatory growth within the pelvic cavity itself. Studies suggest that endometriosis affects up to 1 in 10 women, which is huge. That's it's a massive cost on our healthcare system, and obviously it's a massive cost to all of those 1 in 10 women that are suffering. We don't really know what causes endometriosis. So there's a lot of different factors that can contribute. That can include family history. It can include a retrograde period or menstruation. So that's where instead of the blood flowing out of the vagina, it flows backwards up into the fallopian tubes. Where the growth of the endometrial tissue is as well, the age that you were when you got your first period, the type of period that you have, if you have really heavy bleeding or if your cycle lasts for a really long time, and low body weight is another one as well. So there's a lot of different factors that can contribute, and often we see with a lot of women that they have a number of these different contributing factors all at once. Pain is one of the biggest symptoms that women endure with endometriosis. Now, this pain can occur before your period, during your period. Some women actually experience pain the whole way through their cycle. Some women get pain with intercourse, depending on where the endometrial growths or lesions are. The other thing is that the pain can be not just felt in one area. A lot of women think that it might be isolated to just the pelvis, but it can include like pain with passing urine, pain with bowel movements, pain in the lower back. One of the other most common symptoms is bleeding. So irregularities in bleeding. Some women have really heavy bleeds, or they might just have really irregular periods. So that's another way that you can track or notice that you might have endometriosis. Bladder and bowel problems can also occur. Again, that depends on where the lesions are sitting. So you might have issues with constipation or diarrhea, or you might feel the need to urinate more frequently than usual. Other symptoms that some women experience with endo could be fatigue. That's a really big one, and that comes a lot with some of the other things that we're going to speak about later in this video series. Diagnosis is tricky, and this is probably one of the biggest things in terms of it's not as simple as just matching your signs and symptoms and getting a diagnosis. The only definitive way that you can get a diagnosis is through laparoscopy. So that's a surgery. So they go in and then often they'll treat it at the same time, which is another thing that we're going to chat about later in this series when we get to the medical and surgical management of endo. Although we currently do not have a cure for endometriosis, it doesn't mean that you have to live with pain forever. There's a lot that can be done, and that's why over the next 4 videos we're going to be sending you all these different tips and tricks for how you can holistically manage your endometriosis.